Hello class, welcome to week 9 of the teaching modules. My name is Adarina and I'm going to be presenting today along with Angelo, Angine, Haley, Janessa, Jason, and Trisha, and we're going to be talking about flexibility. So first, let's define flexibility. I think we all know a general definition of what flexibility is, but the official definition is defined as the ability to move a joint or muscle through its full range of motion without any difficulty or pain or any type of external force, like somebody pushing um, on your back to like kind of bend over and stretch your hamstring. So it's all on you. Now that we know the definition of flexibility, let's compare it with hypermobility because those two terms are mistakenly used interchangeably. Flexibility can be positively or negatively affected by activity levels. So if you are active, you're most likely to be a little bit more flexible because your muscles are used to, or your joints are used to being extended through their full range of motions. And if you're not active, they will most likely not be. So it can also be affected by temperature or hormonal changes. Being hypermobile means that you have less tension in the ligaments surrounding the joints, allowing you to kind of go further than your normal range of motion. Being hypermobile doesn't necessarily mean that you are flexible. For example, the lady on the right, she's hyper extending her elbow, her knee, and her hip. It doesn't necessarily mean that she is, stretching out her hamstring, for example. The lady on the picture on the left, she is within normal range of all those joints. So she is lengthening those muscles. And also, as you can see, this is the same person in both pictures. And although if you can hyperextend your joints. I know it's kind of difficult for some people to hyperextend it, but some people, they do go naturally past that normal range. But it's important to know that even if you can hyperextend your joints, to not to and stay within normal range. The symptoms of hypermobility include persistent muscle pain, tendinitis, and frequent dislocation. So you really, even though you can hyperextend your joints, you shouldn't. You should stay within the normal range. Importance of flexibility. This is very important to increase mobility, increase muscular coordination, improve posture and balance, and improve your physical performances. And it also helps you reduce the risk of injuries while performing those physical activities. Increasing your flexibility and maintaining your flexibility is beneficial for people of all ages because, and it's important to start now because as we get older, we lose the laxity in our muscles. So it's important to keep up with it so that we maintain our mobility and we don't get injured. And it's important to start working on it now because it is shown that there is no link between doing regular flexibility exercises and reducing lower back pain or improving any muscular tendinous injuries. But these things can be prevented if you keep up with your flexibility routine so that you don't get injured because once you get injured, you can't go back and try to fix it by, doing your routine that you should have been doing before. So I mentioned that it's important to increase and maintain your flexibility, but if you're not already flexible, there's a couple things you can do to get more range of motion. So what you can do is practice often. It's important to hold stretches long enough. I know I'm guilty of this, where you just kind of want to go into the gym or you just want to do your workout and you don't really think about stretching before. And then you kind of have a really bad workout because you're not, activating your muscles. In this week's reading, the article mentioned about ballistic methods that are used to lengthen the muscle using your body, like the moving body segments, like momentum. The problem with that is it can be beneficial and it also can result to injury. So you really want to be careful about it. I've done this before. I've seen other people do it where they go into the gym and they haven't warmed up and then they'll start like doing a lunge and they'll start like swaying into the lunge. And you want to kind of be careful when you do that because if you do it too vigorously or if you try to stretch the muscle too soon, it can result to you pulling a muscle. So if you do bounce in a stretch, make sure you do it very carefully or do it after your workout where your muscles are kind of warmed up and they're used to being lengthened. And if you stretch often, you hold the stretches long enough, you'll see an increase in your joints range of motion within 3 to 4 weeks of regularly stretching. about like 2 to 3 times a week. And it's important to like it's important for like when you do increase your flexibility and you see an improvement to maintain that. Because you don't want to lose it. Full body flexibility should be done daily for greater gains, regardless of the muscle group that that's being used during the workout session. This routine can be done within 10 minutes, and it's important to understand that a flexibility routine is not used to warm up your muscles like a warm up would do, meaning you shouldn't go on a cardio machine and do a 10-minute warm up and think that's it for your routine for your muscles to be prepared for exercise. You have to take time to stretch properly so that you can work out more efficiently and safely.
I'll be going over the different types of flexibility. And so there's static, dynamic, ballistic, and proprioceptive neuromuscular facilitation, also known as PNF. So for static stretching, it's slowly stretching a muscle group and holding it for an extended period of time. So typically for about like 10 to 30 seconds. And Trisha will be getting more into detail of the what's recommended for the different age groups. And this is effective because you're pulling on the muscle and it allows it to lengthen, which will increase your flexibility. This is recommended to do after an exercise, so post exercise. That way you can get recovery, and or you can do it just for relaxation purposes, waking up every morning. And I have the different kinds of examples in this picture that you could do, which are stretching your calves, your quads, triceps, and biceps. There's a lot more. This one is typically the common one, static, and then I'll get into dynamic after this. It's and there's two kinds of static stretching, which is the first one is active, and this is holding a stretched position, and it's responsible for specific action, which is known as the agonist muscle. And the passive static stretching, that's holding a body part, and that's either with using an assistant helping you with the stretch, holding the stretch, or you can do it with a band. So dynamic stretching is when your muscles and joints are being stretched through a continuous movement in a controlled way through its range of motion. And it's a great way to warm up for an exercise. So this is done pre-exercising. And I forgot to mention, for static stretching, the reason you don't do it before is because it will reduce your training performance because you're stretching the muscle too much. So going back to dynamic, it helps your blood flow through the muscles, and I do have some examples in the picture of different ways that dynamic stretching can be performed before your training or workout. For ballistic stretching, this one's kind of a fun one. I feel like I typically do this one when I'm not working out like during these times as often, so I'm not as flexible, and I haven't been going to yoga classes since it did just like recently, Warrior Yoga recently has opened up, so hopefully soon, and then I can get my flexibility back. But it's all known as like the bouncing method, and it uses your momentum by moving your body to produce the stretch. So if you can see in the picture, the picture with the woman, she is touching her toes, but the one with the man who can't go all the way and touch his toes, so he would be like bouncing up and down trying to reach for his toes, and so that's gonna increase his range of motion by bouncing like up and down trying to reach his toes. It's not as effective since it can it's not as good for your soft tissues or joints when I researched about it, so it's not as effective or safe for those reasons. but I've seen and know a lot of people, including myself, who do this. And for the last type of flexibility, it's the PNF. And this is involving isometric contraction. If you don't remember, isometric contraction means it's activated, but it's not lengthening or shortening. It's just staying at like a constant length. And this is used to alternating between stretches and muscle contraction, which allows the body to reduce excitatory mechanisms. And excitatory mechanisms means neurons firing an action potential in the muscle, which causes the muscle to relax, allowing your joints to be pushed further into range of motion. It's recommended to do after a workout or just again during any time of the day. It uses, if you can see in the picture, typically it's with a partner. So a partner will be pushing up and then you will try to resist. So you'll try to push down as they're pushing up. And that's why this one is not as recommended to do because you need a partner, but you could also do it with a resistant band, as you can see in the picture. A lot of chiropractors will use this if you go to chiropractic office, and it's just a great way. It's not as practical, but you'll produce like larger gains in flexibility in some of the joints.
Hi, my name is Janessa, and I'm going to be talking about the factors that affect flexibility. These factors are in no particular order. There's 5 of them. The first one is going to be skin and connective tissue surrounding a joint. And Adarina did mention earlier in this presentation, she was discussing hypermobility. And basically, laxity is going to be explaining what's happening at that joint and what causes that appearance of hypermobility. Laxity is the looseness of the ligaments and tendons at the joint, not the bones. It's going to create more range of motion the more laxity someone has. And if you have very stiff joints, meaning the tendons and ligaments, not the bones, you will have less laxity and less range of motion. So that's going to affect your flexibility. If you are hypermobile and your joints have lots of laxity, you're going to have greater range of motion, greater flexibility. If you are a person that has very stiff joints, meaning the tendons and the ligaments, you're going to have less laxity, less range of motion, less flexibility. The next factor I'm going to discuss is genes. So hypermobility is inherited. I did look up a small study, and it was observing 54 subjects of I think 2 or 3 families, and basically they were looking at patellar dislocations and joint laxity within those families, and it was found that it was a dominant gene that was inherited by some, but not all offspring. Women do typically have more laxity than men due to sex hormones. So I did look into this as well, and I did find another study that took place. It was observed in young children before puberty that they had the same range of motion, and those same children, or no, children after puberty did girls did display greater range of motion, greater flexibility after puberty than typically boys did. Another factor that affects flexibility is scar tissue. It's good that our bodies close wounds so we don't get infections. I did provide a couple photos here that can give a better visual on how an incision or scar can prevent range of motion, particularly in the shoulder girdle right there. If we wanted to extend our arm backwards, that may be so dense that we aren't able to reach that range of motion. I did also want to point out the 4 stages of wound healing. I'm not going to discuss the names of each of the stages, but I did just provide that as a good visual to show how scar tissue that would form after that blood clotting does affect each layer of the epidermis. I did a little digging and I did find a study that took some tissues, stretched them out statically, and it was found that collagen bundles in scar tissue were more densely packed than in healthy skin, and that specifically is what's going to limit extension during a stretch and affect one's flexibility. For example, with that picture in the slide there, it's very dense collagen bundles, which is different than healthy skin, so dense that it actually constricts and doesn't stretch. So just to wrap up this slide, collagen orientation is abnormal in the scar compared to healthy skin. The fourth factor that we're going to talk about is age. It is generally known that the elderly do typically have a more sedentary lifestyle. This is for a variety of reasons. We're going to focus on one reason, and that reason is that the older we are, the higher the likelihood is that we've had scar tissue and that we've had an injury. We did talk about laxity earlier, but one thing that we did fail to mention was that when a joint has high laxity, when a joint is very mobile, it is more unstable. So say someone hurt their knee and they really hurt that ligament, they're going to have more joint laxity. And what that means is that joint is going to become more unstable. So an elderly person, knowing that, may not go on a trampoline and jump on that trampoline and get their fitness in. Another related component to age would be that less collagen is produced. And what collagen is it's an elastic property that's found in the tissues that's going to help allow the tissue to stretch. I did review a small study that took some elderly adults and some younger adults, put them through some tests, and took a look at the patellar tendon. And it did find that the older adults had less dense collagen versus the younger adults, meaning that the older adults had less elastic in their tendons versus the younger adults had more densely packed collagen, more flexibility in the tendons themselves. The fifth of 5 factors that affect flexibility would be disuse. So if you were to stop your flexibility training, you would most likely lose out on flexibility and range of motion. And that is due to the fact that muscles pull and they don't push, meaning they contract and their function is to contract, not to extend. You can extend your finger, but that's going to be due to muscles in the finger contracting to extend your finger. So hopefully you can understand that muscles don't push, they just pull. And the reason I'm saying that is because if you were to contract a muscle and you never stretch it, there's nothing helping it to return to its normal state. And that lack of stretching is going to affect your flexibility. You are going to feel more stiff. You are going to feel like your muscles are in more of a contracted state. So we did discuss those 5 factors that affect flexibility. The first one was the tendons and ligaments surrounding a joint, otherwise known as laxity. The Second was genes. Third was age. Fourth was scar tissue. And the fifth one was disuse.
So, what is neuromotor exercise? So, neuromotor exercise typically involves exercises that help your motor skills, so like agility, balance, coordination, your gait, and your proprioception. So, for those of you who don't know, gait it's essentially an individual's walking pattern, which involves balance and coordination. Your proprioception is essentially your body's ability to sense its own movement and position. It's similar to spatial awareness, but it's not exactly the same thing. They kind of go hand in hand, but they still aren't exactly the same thing. A lot of neuromotor exercises take aspects not only from flexibility, but from resistance training as well. Some of the examples of those exercises will be explained a little bit later. So, why is neuromotor exercise important? It's important because it's mainly used to improve your ability to complete everyday tasks. So, like walking, being able to go up the stairs, being able to pick something up off the ground without falling over, as well as being able to get back up. It's very good for elderly people because they are the main group of people that will be that will usually have trouble completing these everyday tasks. So it's just definitely good for them to be involved in things like this. These type of exercises are typically used in comprehensive exercise programs, which are usually used for elderly people. For those of you who don't know, these are typically programs that will evaluate an individual's fitness level, and flexibility and balance are two very big components in these programs. And those are things that neuromotor exercise will be able to help with. Even though it is more beneficial for older people, it can be used for younger individuals. However, there hasn't been too much evidence or studies that can really accurately prove how much it can really help. So, due to insufficient research, there have only really been theories that neuromotor exercise can help younger athletes improve their motor skills, like in a way that would actually help them improve their athletic performance. And even though there's not a lot of research, there have been a few studies, and some have found that these exercises can be used to reduce ACL injuries as well as other recurring ankle injuries. As far as the recommended guidelines for these exercises, all we really know for sure is the frequency, which would be 2 to 3 days a week, and the time, which would be 20 to 30 minutes of the duration of the exercise. We don't really have enough research to specify the intensity, the volume, the pattern, and the progression of these exercises. So I was able to find a particular study that involved neuromotor exercise. A particular study was involving neuromotor exercise as well as resistance training. So it was a study to see if neuromotor exercise was just as effective in improving mobility, and other health-related fitness components in older women as resistance training was. So in this study, they took 35 women between the ages of 65 and 75, and one group was assigned to do the neuromotor training and the other half was assigned to do the resistance training. So each group was monitored and they trained 2 times a week for 12 weeks. So both of the programs had a warm-up and other exercises included in their particular program. So for the neuromotor exercise groups, they would do walking, stretching of all the major joints, and then for conditioning, they did exercises that had to do with hand-eye coordination, agility, and dynamic and static balance. And then their floor exercises included light ab exercises, back limb exercises, as well as stretching of those as well. So for the resistance training group, they started off the beginning of the program, I believe the first 2 weeks, they started from in between 40 and 60% of their 1 rep max, and their goal was to get that up to their 80% of the 1 rep max. So their exercises included free weight exercises, floor exercises, and other machine exercises as well. And they would do it for all of the major muscle groups of the body. And so basically the results that they found was that neuromotor exercise was just as effective in improving a lot of these aspects like mobility, but it's better to use them both together, just because neuromotor exercise isn't as beneficial in improving your strength, which is also something that elderly people need in order to do their other daily tasks.
Okay, so now I want to go into a little more depth of what neuromotor exercises actually work. Neuromotor exercises, they not only work your muscles, but they also work your brain. The neuromuscular system links your brain, spinal cord, and your sensory receptors to all the muscles throughout your body. So this is integrating the sensory information to coordinate appropriate muscle actions to produce these desired movements when performing these exercises. Neuromotor exercises, they help people navigate through their daily surroundings efficiently, effectively, and safely. Neuromotor exercises can improve your reaction time in response to changes to your environment and your body positions. So if you were to close your eyes, or if you were to stand on one foot, or change the hardness of the ground, say you were standing on cement and then you went to stand on grass and then you went to stand on sand, they all change your proprioception and your balance. All right, so with assessing neuromotor fitness, there are 5 different tests. There is the 4-stage balance test, the standing reach test, the Edgren side step test, the agility T test, and the 8-foot up and go test. A selection of 2 or 3 of the 5 would be sufficient to track the functional neuromotor improvements over time. These improvements would include balance, agility, coordination, and body awareness. The first test I'm going to go over is the 4-stage balance test. This test assesses static balance and proprioception. For this test, you will need a stopwatch and a wall or a fixed object like a chair. The wall and fixed object is in case someone loses balance while they're performing these tests, just to catch themselves in case they fall. For this test, have your client stand near this wall or the fixed object with their shoes off and their feet together, and have them hold this position for 10 seconds. See figure A for this position. It's just standing with your feet together and your shoes off by the wall for 10 seconds. And if your client is able to hold this position for 10 seconds, then have them shift 1 foot slightly in front or behind, either one, just so they are a little off centered. So one is slightly forward, one is slightly back, but they're still next to each other. see figure B to see a better picture of this. If they're able to hold that for 10 seconds without touching the wall, without touching that chair, and able to hold their balance for 10 seconds in that position, have them slide their foot back further so that they are heel to toe, having one foot in front, one foot in back. See figure C to see that picture better. If they're able to stand in this position without touching the wall or that chair for 10 seconds, then have them advance to that single leg stance in figure D. This is the ultimate goal. As your client progresses to the above average, then they are able to close their eyes, have them do this single-legged standing position with their eyes closed. This changes their proprioception and has them more aware of their body position rather than having their eyes open. The second test is the standing reach test. This assesses standing balance and the postural control of your client. You will need a measuring stick and measuring tape for this. Also, a wall. All right, for this test, tape a leveled measuring stick onto the wall horizontally at the shoulder height. Have the client stand with their right shoulder to, but not touching the measuring stick. Raise their arm, have their client raise their arm to the shoulder height, parallel to the ground, making a fist. And note the number in inches or centimeters where that fist reaches that measuring stick onto the wall. See figure A for a better picture of it. I know it's hard to see on Zoom. When you're ready, have your client with their arm outstretched, reach as far forward as they can without stepping or losing their balance, and keeping their arm going along that measuring stick, just leaning forward, keeping them going straight along that measuring stick. And see figure B. I know I can't do it justice sitting in a chair, but I have those pictures, so hopefully that helps out. Note the number on the measuring stick at the location of their knuckles and calculate the difference between the starting and end position. Remember that if you're using a yardstick to convert from inches to centimeters, you multiply 2.54. That'll be important just in when you're looking at the norms table. All right, so if you're at a standing reach score less than 6 inches, it indicates that the client is at sufficient risk to falling. And if they're at 6 to 10, it indicates a moderate risk to falling. The third test I will be going over is the Edgren sidestep test. This one assesses sidestepping, agility, quickness, and balance. For this one, you'll need masking tape or cones, depends on which one you want, tape measure, and a stopwatch. This location, you'll need a flat ground that is not slippery because you'll be doing some side steps and quick back and forth. So you don't want your client to be slipping. So for the layout, you will have 5 marked lines using the masking tape or the cones that are 3 feet apart. They're going to be in a straight line, numbered 1, 2, 3, 4, and 5, all 3 feet apart. And have the client start standing at the 3, at the middle of that line. And when they're ready, have them begin sidestepping to the right until the right foot crosses that last cone or line. Have them sidestep to the left until the left foot crosses that far left line, and then have them sidestep to the right. And they're going to keep going for 10 seconds until they can, and we're going to count how many lines they pass. So the client's going to be sidestepping left to right for that 10 seconds.
and the test is measured by how many lines or cones, whichever one you use, the client passes within that 10 seconds. As one progresses, they can add in that cross step, going into a braided side step test. And this just adds a little more agility to it, adds more balance to it, but you're still doing the same scoring process with that 3 feet 3 feet distance in between each cone in a straight line doing a side step. And for 10 seconds, just measuring how many cones or lines you pass. The fourth test is the agility T-test. This test assesses agility in a forward, side, and backwards motion. This one, you'll need tape measure, cones, and a stopwatch. And again, a flat ground that is not slippery, because you're going to be doing fast movements and you don't want to be slipping. For this one, you're going to have the 4 cones set up in a T figure and have them labeled A, B, C, and D. So A is the starting point, and that's the bottom tip of the T. C is going to be that top left. D is the top right, and B is in the middle. So from C to D is 10 yards. From B to A is 10 yards. C to B, B to D is 5 yards. That picture, figure 4, you'll be able to see way better, but you'll have it set up just like so. And have the client start at cone A, and when they're ready, start the stopwatch and have them move as quickly as possible to cone B. Have them touch the cone with their right hand. Then sidestep to the left over to cone C and have them touch the cone with their left hand. The hand placement is actually important, so they have to touch cone C with their left hand. Then have them sidestep over to the right to cone D and have them touch the cone with their right hand. Sidestep cone B, have them touch the cone with their left hand, and then step backwards, so back pedal back to that position cone at cone A, and then stop that stopwatch and record the total time that it took to complete this test. This 5th and final test that we're going to go over is mostly used to assess neuromotor function in older adults. It's the 8-foot up and go test. So this assesses agility and dynamic balance in, again, older adults. You will need a standard height chair, so approximately 17 inches in height, and a stopwatch. Have the chair placed against a wall and make a mark on the floor at 8 feet away from the chair. When the client is ready, have the client stand up from the chair as straight as they can, walk to the line on the floor at a comfortable pace, and once both feet are past the line, have them turn around. Have them walk back to the chair at the same comfortable pace and sit down again slowly. And then record the time it took them to stand up, walk the 8 feet, turn around, and sit back down. With this test, the lower score, the shorter time it takes, the better. If you want someone there with the client standing next to that chair just in case they were to fall, because this is for older adults. They are testing their balance to be able to stand up and sit down by themselves. So it's important just to make sure that they're safe when conducting this test. And like I said, the shorter time, the better. To move away from the assessment of neuromotor fitness to just regular physical activities that you would see in a normal day, Two of the most recommended activities are yoga and Tai Chi. These both have a combination of neuromotor fitness, resistance, and flexibility. These are both low impact exercises that directly benefit your balance, motor control, and proprioception. They act to slow down your movements, focusing more on that coordination and your body positioning.
For this section, I will be touching on the recommendations for the health and fitness. We're going to do a little bit more of a flexibility version, and we definitely want to hone in on the SMART goals and the FITT principles. To review the SMART goals, that's going to be you want to have specific goals, you want to have measurable goals, achievable / attainable goals, as well as relevant and in a timely manner, according to your individual state of physical fitness. Moving on to the FITT, that's definitely going to be the frequency, intensity, time, and type. We've definitely gone over those in our previous classes. So we'll just kind of be very vaguely touching up on those, but we'll definitely go and dive in deeper as far as like those details of what is recommended for average healthy adults to older adults, as well as just athletes as well. Moving on to the FITT principles, the first being frequency, we definitely want to recommend that 2 to 3 day per week for any average healthy adult. However, with older adults, it's important to encourage them to perform either a couple more sessions or a couple more days per week of flexibility / stretching sessions. As well as athletes, it's important for them to warm up their muscles before any dynamic or muscle component activities. So we'll definitely touch later on in that through the video. Moving on to intensity for any realm of adult, whether it's older, healthy, unhealthy, regardless, like whether you're starting out as a beginner in the program, it is important to understand flexibility and just also feeling those stretches and knowing when to stop. That being whether your muscle starts to quiver or a sharp pain occurs. You definitely want to back away from that stretch slowly. But ideally, you are trying to stretch to a point of tension or just slight discomfort, anything like that. And then we will touch on type and time in the next slide. Moving on to the other two T's of the FITT principle, it's going to be time and type. For most adults, it is going to be that 10 to 30 second hold for any static stretch. However, with older adults, it is recommended that they hold a 30 to 60 second stretch hold. That may be more beneficial for them. Specifically for the PNF stretching, I found that it was 3 to 6 seconds at 20% to 75% contraction or max voluntary contraction, followed by that 10 to 30 second hold for an assisted stretch. So for most adults, ideally for a full routine, hitting all of the major muscle tendon units can be achieved within 10 minutes. So it's not hard to kind of incorporate any sort of stretching, anything that's flexibility induced into a warm up, post warm up, or just a standalone program, which we will touch on later. As far as type, a series of flexibility exercises for each major muscle tendon unit is recommended on a daily basis, if possible, for just that full body range of motion and just enhance daily living. However, it may vary from person to person dependent on whether it's a sport being played, age, a lot of components. However, some major muscle tendon units can be the shoulder girdle, the chest, the trunk, lower back, hips, the legs, and ankles. Those are definitely main spots that you want to hit and kind of incorporate in your stretching sessions. There is a part of the FITT that can dive deeper, that is including volume, progression, and the pattern itself. Fortunately, as far as progress or progression, a lot of methods are unknown for optimal progression just because there hasn't been a lot of research backed by increasing flexibility as far as like muscle components, certain sports, any of that. We do need a little bit more information to be conducted on that matter. As far as pattern, though, it is recommended that a repetition of each flexibility exercise is performed 2 to 4 times. That's going to be most effective for that muscle group. And as far as volume, adjusting duration and repetitions according to individual motor control, proprioception, and just overall quality of life. Tendons do lengthen in proportion to the magnitude of the load that is applied to them. So it is common to see best results within small loads over a longer period of time versus larger loads in a smaller period of time. Those also kind of tend to induce a little bit more of like an injury or just uncomfortability. But ideally, the volume in total is to perform 60 seconds time total for each flexibility exercise performed. So that can be in different sets, different timings. If you are performing a PNF stretch, you might do a total of 2 sessions where at the end you are having an assisted hold on that. And it is a bit of a longer stretch. So you might either split that up into 2 or 3 sessions. If you're doing a static, you may want to do, I would say, closer to maybe 2 to 4 or 5 sessions. That would be best recommended, but it also kind of depends on what sport you're going into or preparing for, or just kind of any exercise session or physical activity session you are preparing the body for. So, as it comes to when you should incorporate these flexibility exercises so that they are most effective, first things first, revisit your goal, understand where you want to be, where you are currently, and also where you intend on being in the future as far as these goals. Whether you're implementing a flexibility training session as a standalone program, or you're adding a little bit more stretching here and there pre and post activity session or training sessions, those are very important to take into consideration. However, with little research done and kind of available on the effects of stretching programs of different like duration types on the different exercise activities themselves, uh, these FITT recommendations are ideally based on a general fitness program with no real target emphasis. So athletes, anybody who needs a specific program tailored for themselves probably wouldn't benefit most from this. It would just be kind of like a general population getting into physical activity or anything like that. And obviously, these can be anywhere from aerobic activities to passive stretching. These can increase flexibility and your range of motion. Ideally, it would be best if you implement a little bit of both of the two. Those are seen to have a little bit more success with increasing that. And below are a couple of just examples. These are just a couple, but as far as passive stretching, you can include massages. Massages is considered an external method for passive stretching as well. But below are just a couple of main categories that do count as these stretching techniques. As far as when to incorporate these stretching sessions and or flexibility training sessions, these can be done in a pre-post exercise session and or just kind of like a standalone program. Um, it's more widely accepted that we warm up, and as a part of a warm up should stimulate our circulatory system. It should enhance coordination and just ideally promote freer and easier movements. With that said, each warm up should be tailored specifically to the needs of the movements and or sport, including flexibility as a main component. This is actually often seen in dynamic recreational sports. Um, it's most beneficial to actually have a mixture of cardiorespiratory and flexibility components in a warm up for these athletes, as it inhibits these easier and freer movements. But a failure to warm up could also have a downside. It can result in strains to the muscles and or tendons, muscle tightness, and essentially injury too as well. As far as a post regimen for incorporating a cool down, is more than likely considered a cool down after any training session. And it can include cardiorespiratory and or resistance exercise. That is definitely going to be the most common. They have been found to be reduced symptoms of associating with DOMS, which is delayed onset muscle soreness. Specifically, static stretching is very beneficial to this, and has been found to be used by many athletes as well. Um, on the other end, it can be used as a standalone program, which is usually can be a mixture of any one of the types of the stretching. However, the most beneficial is going to be that static and PNF. That's going to be the safest and most effective way to increase that flexibility component. It's often recommended as a method to alleviating muscle soreness following strenuous, vigorous, or prolonged activities, because it does enhance the overall well-being and mobility through just increasing quality of life. Um, and in that same sense, it can also be used as a rehabilitative treatment program and injury prevention or reoccurrence too as well. So incorporating flexibility sessions is very important, regardless of whether it's before, after, or just even a standalone program itself. Last but not least, safety tips to flexibility training is ideally just don't overdo it. That is going to be a primary safety concern. And that's just lack of knowledge, and that's okay. Everybody's learning at their own pace. We're all kind of going through it together as far as creating programs for ourselves, learning how to do so. Once you stretch a ligament, it's permanent, which obviously increases our joint laxity. So just be careful and be cognizant, as that also can increase the probability of future joint injury as well. And we want to also maximize our stretch time. That means like stress reduction. That could either be controlled deep breathing. That also kind of changes chemicals being released within our body, which has an overall lasting effect on our stress reduction. Just improving our mental well-being. We all want that. Next, stretch consistently for maintenance. This often pertains to older adults and is very important for them to implement some sort of flexibility training or stretch sessions throughout their daily lives, to inhibit and maintain those daily living habits as well. And last but not least, stretch agonist and antagonist muscles, both limbs alternatively. This just avoids flexibility imbalances, and those can also cause injury just as much as any other, just not being flexible, vice versa, too, as well.
So now we move on to the general recommendations to neuromotor exercises. As previously mentioned, the field of neuromotor exercises lacks the research to a number of populations. As you have read in the Garber article, um, neuromotor exercises that are facilitated in 2 to 3 times per week has resulted to improvements with at least 20 to 30 minutes per session. The types of neuromotor exercises varies, so there isn't much research or data collected as to what intensity is recommended. But the types of neuromotor exercises can range from Tai Chi, Qigong, or yoga, as mentioned in the um, recommended reading. You can also directly tackle the targeted motor skills, such as balance, coordination, gait, agility, and proprioception with exercises you can think of like balancing exercises on a Bosu ball, or like the ladder exercises that we saw on the KINS page from last week. So one of the examples that was mentioned in the article was Tai Chi. Now, if you're not familiar with the Tai Chi, or you've heard about it but didn't know really what it was about, it's basically a form of meditation in motion where you do a bunch of physical movements and stretches that somewhat resemble a weightlifting routine, but in a very gentle manner. Um, Tai Chi is most commonly practiced by the elderly, so most of the articles that I found were studies about the effects of Tai Chi on the elderly population. So, in a study performed on adults of at least 65 years of age, that engaged in Tai Chi experienced an improvement in balance, improvement in overall physical health, and improvement in quality of life. In another article that evaluated the research-based use of Tai Chi, they have cited that overall Tai Chi has improved muscular strength with decreased blood pressure, decreased swaying from side to side, and reduced the risk of falls. And the Tai Chi also promotes proper posture. In the same article, Tai Chi users or participants had a more efficient ventilatory volume on a cycle ergonometer. Um, from a psychological standpoint, researchers have found that Tai Chi has improved or promoted positive psychological well-being for positive mood changes, and it also improved their quality of sleep. So a specific program that has been consistently popping up in the research for neuromotor exercises is a program called EFAM-UV, or otherwise known as en- Entrenamiento Funcional para Adultos Mayores. Hopefully I got that right. I believe it means functional training for elderly adults, I believe. Uh, but the article has been consistently cited was in Spanish since the researchers who conducted it were from Spain. So I was not able to get the full details of how it got developed, but I was able to get the gist of it using the articles that have been citing it. So this program was designed to be easier to maintain and adhere to since it only calls for 2 sessions a week with sessions lasting 30 minutes. This program was periodized into 3 main phases. The first one being a conditioning phase. Next one is a neuromuscular phase, and the last one is an endurance phase. These 3 phases help analyze the overall functionality of older adults. So the article have cited that the program had great enhancements in executive function, which included better working memory, more cognitive flexibility, and better self-control. This program also helped enhance the functional fitness and health-related quality of life, and especially the body composition of elderly adults. This program is highly recommended for the elderly since it doesn't require any fancy facility or any fancy equipment, and it is easy to integrate into the community setting.